So, today we are discussing peripheral atrial disease. Peripheral atrial disease. Peripheral arterial disease, like in short form, we can say it PAD. Atherosclerosis, like form here. It means a formation of plaque. Like plaque formation, as we can see, there is a vessels atria and there is a plaque formation here. Plaque is anything like basically it's low density lipids. We can see like basically low density lipid LDL it cause. And it's happened mostly in lower extremities, means lower limb. For example, femoral artery, iliac artery, anything. Like, let me show you. If you look, it is aorta. Okay, from aorta, like two common iliac arteries goes. Okay, and then it's divided into external iliac artery and internal iliac artery. External iliac artery, internal iliac artery. Here, like we have to do goes down here, and its external iliac artery goes across the iliac ligament, and then it's from femoral artery. We call femoral artery. It goes into popliteal fossa, and it's became popliteal artery. Here, let me show you with another color. Then called it popliteal artery. And when it's also divided here from two parts. Mm, anterior, posterior. Posterior tibial artery and anterior tibial artery, and it goes down. And also there is uh, it goes into dorsalis pedis artery is there. Clot can form anywhere, like here, anywhere. Like these are the clot. It's external iliac artery. It goes femoral artery. Then it's converted into popliteal artery. Popliteal artery converted into posterior and anterior tibial artery, and then it goes in dorsalis. In diagram you can see here, and iliac arteries convert, and here the femoral artery is there, and popliteal fossa is there. Popliteal artery is converted into tibial artery. Okay. Huh. So as we can see, like how we determine like what is the risk factor for that. The risk factor for that is smoking, hypertension, diabetes mellitus, and old age people generally get that. If we look the patient, like clinical feature of the patient who's suffering from PAD, peripheral arterial disease, we can divide into degrees, 3 degrees ischemia. Basically, if any clot has happened, it causes ischemia. In first stage, claudication is shown. Like initial stage, we can say claudication means uh, it will pain like during exertion of lower limb. Like exertion means exercising, walk, running. The demand of O2 increase at that time. So when we run and walk, the leg pain increase, or it's called exertion. And when it release, like the pain goes down, it decrease with releasing. It's also compared with the stable angina. And if we look about like the second degree of ischemia, also known as like advanced PAD. So here, like it's also pain in rest, like pain increase by elevation, and pain decrease by like when we relax our legs and all. Basically because of gravity. Like here, no biological reason, only gravity is the reason. Okay. The last and most dangerous stage is like third, like acute limb ischemia, and this plaque rupture, like that plaque get rupture, burst out, the thrombus rupture, to rapid obstruction has happened, like blood flows in the bodies and all. It's similar to MI, but here, like we can't see troponin. It is that much level of ischemic and so harsh. If we look about the symptoms, like how, like what kind of symptom we can see. So here we also classified into the stages, like we can classify the symptom on the basis of stages. First, like chronic symptom. Okay, chronic symptomatic. So in first stage, we can see claudication, cramp, and cough, and also distal diminished pulse, like distal pulse. In leg, their pulse get very low intensity pulse, like become cool, dry, slimy, and hair also lost because of less blood supply. The nail get thicker and brittle too, like easily break. And Barrett form, abnormal blood flow, we can say, or turbulence in blood. And if we go down, like if we look about what happened with the stage two, like what are the symptoms of stage two? The chronic limb threatening ischemia, we can call the stage two, as we know the advanced PAD during rest is also pain and all, and less while we in resting position due to the gravity, while we put our leg down due to gravity. Hmm. So in this situation, like ischemia ulcers form. Ischemia ulcers, we can define it on the basis three types of ulcers like form. Basically, first is ankle lateral ulcers. If you look at the image, there are 2 feet. Okay, these are the ankles. The both these are the two great big toes. So the lateral ankle, as we can see here, the ulcer develop, the cell get dies and all. And distal toe. It's also called ulcer in distal toe. Like if you look there, here you got ulcer in the toe. It's nail bed, you can see. Ulcer, it's called. The reason is simple, like oxygen is getting low, tissue dies, and the dies of tissue, like when tissue die, also called gangrene, cause lot of trouble. Mm, we have to cut that part where the tissue die, like basically the color changes, like pinky, bluish color, and also affect on the digits of the limb. Another kind of like problem is the acute limb ischemia. Acute limb ischemia. Simply like how we diagnose this thing by ABI. ABI, ankle brachial index. Uh, there is a formula to calculate this. As you can see, ABI stands for systolic pressure in brachial artery and systolic pressure in dorsalis pedis artery. Okay, so how it diagnose and all here is all described. In ABI, ankle brachial index, if it is greater less than, so if it's less than 0.9, if the value of ABI less than 0.9, we can say it's PAD, peripheral arterial disease. But if the ABI index, like ABI, more than 1.3, still it is PAD. But here what happens? The blood vessels gets calcified, like calcium deposition, and it's get hard. And one of the most important thing, if the ABI value goes lower than or equal to 0.4, it's so severe, can cause a lot of trouble. Like we have to do that procedure of cutting and all. The procedure of cutting, amputation, it called. Like amputation is known as. I'll describe about it. And also the similar things like ABI, there is TBI. TBI means two brachial index, similar to ABI. Same formula, like just need to replace that thing. Ankle with toe, grade two. True brachial index, in which we have to do like systolic blood pressure in grade two divided by systolic blood pressure in brachial artery. Simply, it's systolic blood pressure of grade 2 divided by systolic blood pressure in brachial artery. Simple. If the value is less than 0.7, then PAD is fine. But after these, the second most like prioritized step are Doppler ultrasound sonography, like ultrasound we call Doppler ultrasound and all, and the similar to it, it's a CT angiography, just for confirming PAD. As we go for like management, I have to discuss a fact about this. Uh, if a person is like having PAD, the 20% chance, yeah, like I can show you, the 20% chance of MI, like myocardial infarction is there in next 5 years. Myocardial infarction in next 5 years. Like as you can see, 20% chance. And the 30% chance of that due to myocardial infarction or stroke. So severe, like you can remember this as a fact. And if we look for management, here, like I written something. Let me show you. Management. Two management are there. First, like when the secondary management, like what we do, and the prevention of PAD. PAD is like a alarming stage for like CAD. PAD alarming stage of CAD, like coronary arterial disease. Sorry, coronary arterial disease can cause. Simply means clot formation, clot in coronary vessels. If we look like how we reduce it and all, we give the patient like we treat PAD by giving a high intensity of a statin, like rosuvastatin is there, aspirin we can give, and the most important and the basic step is like we call the patient and we tell the patient like to quit smoking, complete smoking sensation. Sensation means quit, quit smoking totally, and we have to do BP control. We can give AAC inhibitor or ARB inhibitor, like lisinopril is an example of this, and lostratin. And also you have to do like the diabetic control. You have to control on diabetic. And if we look about the primary PAD, it seems like it seems primary what can do if a person is having clot in any femoral artery and all. The primary thing we do is there is an exercise program for 30 to 45 minutes. It's not like normal exercise like running and all. It's proper in guidance. The exercise is maintained and like designed by doctor according to the patient. Thrice in a week, the patient will do with the proper guidance, and we can use some medicine like silostazol. It is also used for antiplateling and vasodilator. And also, it is inhibitor of phosphodiesterase. If we look about complication, like what kind of complication is there? Though here is less disease it can cause. Like what happened in Laris disease? Basically, a plaque at aortoiliac junction. Aortoiliac junction. Let me show you. Let me show you aortoiliac junction. Imagine this is aorta. Okay, and from here, I already told in previous the external iliac artery form. Aorta and iliac artery, like right, common iliac artery. Sorry, common iliac artery. That's left and right common iliac artery. The clot is formed here. Here the clot is formed. So it's so dangerous. What it can cause? Let me show you. Bilateral hip and thighs pain. Bilateral hip and thighs pain when we walk or run, it will cause. And second thing it will cause is ED, erectile dysfunction because of less flow, blood flow. Blood flow is very less in lower extremities. Symmetric lower extremity, one of the half part get low bloods, it's not working properly. Muscle get weakens there, muscle atrophy, it get weakened, and our muscle strength losing. Limb loss is also there because of gangrene. Gangrene means death of tissue. So here we do the procedure of amputation. Amputation means the removal of the dead tissue from the body. Like anything, amputation have also four stages. If in stage we remove the deserts, and in second stage we remove the mid tarsal part. In third stage and fourth stage is there like from mid of the thigh we remove the leg. That's all for today. Thanks for watching.